Greetings, Eric back, a naturopath, author of Candida Crusher. Thanks for checking out my video. I've got a question here from a patient in Europe, from a small country in Europe. Eric, are all yeast infections related to Candida albicans? Well, they're not. And in fact, after completing over 1,000 stool tests on patients over the years, I can tell you, particularly with the culture, Candida albicans will come back probably about 70%. Sometimes 75%, I would say, when I get batches of stool tests back. I find sometimes patients have mixed types of Candida strains in, which is showing in the stool test. Candida albicans is very common, but we have other types of Candida as well. There are over 250 strains of Candida. But the common ones I would find, over and above Candida albicans would be Candida glabrata, Candida tropicalis, Candida paralopsis, I think it's called P-A-R-A-P, parapsolus or paralopsis. One that comes back a little bit more rare would be Candida krusei. Candida krusei comes back with a few of the Australian stool tests in particular, and so does the tropicalis. So I believe that the tropicalis is a lot tougher strain to eradicate than the albicans. But what you've got to bear in mind is it's not only the Candida albicans we're talking about, because many patients with Candida also have various other kinds of fungi in or on the body and bacteria as well. So we're looking at a whole lot of different types of bugs that can potentially affect the person internally. So it's not uncommon if someone's got chronic vaginal thrush or jock itch to have various kinds of Candida in their system, and also lots of different types of bacteria and sometimes parasites as well. And this will often come about from the routine treatments that they have taken over the years, especially if the patient's been on multiple rounds of antibiotics, has tried all sorts of strange and weird diets, they've been to many different doctors. These patients can sometimes develop resistant strains of Candida and also multiple types of Candida. It's not uncommon. And then they land on my doorstep and they want to get well. So it can take some time. One of my favorite sayings when it comes to eradicating Candida is persistence breaks resistance. So this was just a short video to explain that there are different types of Candida strains that you're going to find in the body. It's not just all about Candida albicans, which is the common one. Okay, so if in doubt, a good idea is to take a stool test, a comprehensive stool test performed 3 stool samples over 3 concurrent days will often give the practitioner a good idea of what's really going on. Make sure that the stool is cultured, so to see if they can grow anything off the stool, as well as microscopies performed so they can actually look at the stool, macroscopically is looking at it, microscopically is using the microscope to look at it. And that's the best way to have the stool test performed. So I hope that answers your question regarding the Candida. It was not just all about Candida albicans. Thank you for your attention.